Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. I'm joined today by Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. Today we'll be talking to you a little bit about an update on COVID-19 status in our community, some things that are going on in our state, some public health issues that are being studied over the course of the past week, some issues that have changed over the past week or so with regards to visitor restrictions within the hospital, and what we should anticipate over the course of the next few months or so. So probably most importantly, just update on where our numbers are. We've tested almost 1,000 people within our community, and so far 33 positive within Knox County. And I think the important thing to discuss, and we'll touch on this a little bit throughout our discussion today, is despite some additional cases over the course of the last few weeks or so, the cases that we have seen have not been of the severity that we saw kind of in the initial phases of when the exposure came to our community. So we've seen a few extra cases over the course of the last week or so, and looking at those numbers, we've got 33 total for Knox County right now. And as reported by Dr. Stewart, those cases are recovering well at home. We haven't had as many hospitalizations with regards to that. And more importantly, if we look at the statewide numbers over the course of the past few weeks or so and go back and kind of squint at the chart, you can see that probably late April was when the state saw its peak, and then as we kind of average that out, you can see that those numbers have continued to drop over the course of the past 4 to 6 weeks or so. So that's certainly what we hoped would happen. Right. And then the other thing that I think is very encouraging is when we look at the death rates, the death rate has continued to decline. So maybe we're seeing what we had hoped, which was peak has occurred, we're seeing that decline, and maybe the virus is becoming a little less virulent than what we had seen previously.
Yeah, I think in the last week we've seen about a 25% increase in cases, but none of those cases are hospitalized, which is speaks to that less virulent. Also, the population that is getting sick is a younger, more able to handle the virus population. Still, the older population, the medically vulnerable population, are at higher risk, and the data continues to tell us that. But as we look at that early May 4th, that late April peak, May 4th is when the Back on Track plan started. We've seen a downward trend of cases from a state perspective, and that's really positive. And even what we're seeing locally, the main thing that we talked about was, can the healthcare system's capacity handle the number of individuals needing care? And we've been able to do that, and we still feel very confident going forward throughout the summer that we are able to meet those needs of the community, and a lot of home care and instructions that are being given in that route.
I think the question that I certainly get asked the most is, why are we all wearing masks? On a daily basis, on an hourly basis, my patients, my family, my friends, why are we wearing masks? And I think what we led off with, which was that we've actually seen an uptick in the number of cases, is basically an excellent display of what we kind of anticipated, which was going to happen, which was we were all going to go back out, engage in activities, be out in the community, be around more people. And so we've seen an increased spread as a result of that.
It's counterintuitive, right?
Yeah.
You say we're opening back up and things are relaxing, but now you have to wear a mask, and we didn't.
Right.
But as we've talked about, the risk of spread, if you can't socially distance, so you do not have to wear a mask from the time you wake up until the time you go to sleep. If you cannot socially distance, maintain that 6 feet safety measure. We know that the virus, there's potential asymptomatic spread. I guess I shouldn't say we know that. There's potential patients that have the virus that are asymptomatic. We don't know the actual spread of that or not, but that's the safety precaution. Certainly in our world in healthcare, with interacting with patients, it's very hard to conduct a patient visit with staying outside of 6 feet, so the masking is appropriate to keep everyone safe.
Yeah, and I think you mentioned data, and we keep talking about how one of the great things about being in a rural community is we get more data because everything has been a bit more delayed. And so we've been blessed with the fact that can be something that we get the information that other people didn't in a more timely fashion. But a big thing was occurring over the course of the past week. The IU School of Medicine Public Health School basically started conducting their second phase of what their random population study was. That started in the middle of last week, and I think that finished up Sunday. Was that when that was done? So what we're excited about is looking at those numbers to say, okay, within our community and then also within our state, state. How prevalent is the disease? We got that very interesting data that came as far as the number of people that were positive that were asymptomatic, never displayed any symptoms, were around 44 to 45%, which was quite amazing to us. And so this study will continue rolling on, and the school was very good about getting that data out within about a week of when it was collected last time. So we anticipate hopefully over the course of the next week or so, that data has been released, and we will share that with you as well. But it speaks to that potential asymptomatic spread and why we're wearing those masks. And again, we want people to be comfortable with what they're doing, and if you can't maintain that social distancing, we want you to wear a mask. Obviously, we all will be within the health community to make sure that we're keeping you safe and keeping us safe as well as we continue to deliver health care. Adam, you want to talk a little bit about, we've really held people off for many weeks and kept them home, kept them safe, and then we've invited them back in, and we've really seen a big uptick in the number of visits and volume of everything over the course of the past week or two.
Yep, for the most part, at Good Samaritan, so all services are open, but we're also approaching 95% of our services from a volume standpoint that were provided pre-COVID. Now, we're able to do that because of universal masking, because of safety precautions around when patients enter our facilities, whether it's the main campus here, the hospital, whether it's a practice, that we are going through the screening stations or screening at the office to ask for symptoms and make sure that we're identifying patients as soon as possible for those safety reasons. And we're utilizing virtual visits as we open up services. You'll notice if you come into the building that some of the waiting room chairs and seating have been either moved around in a new configuration to space out, or some chairs have just simply been removed to help with spacing. And we continue to evaluate how to make that work best so that it's convenient for our patients, but also keeping that safe distance. We have a number of our offices, such as medical center, that have multiple entry points that have been reduced to one, and now we're looking at how to slowly reopen those to make it, again, convenient access, but also still being able to catch folks as they walk in to make sure that they have a mask and know where to go, and are not, from a traffic standpoint, are keeping that down as much as possible. And then here at the hospital, the same entry points through the health pavilion or cancer pavilion or emergency room. You may know the 6th Street awning entrance is one that is shut down. That's an employee-only entrance now and for the foreseeable future, just again so we can have those checkpoints as we move forward. We've also allowed visitors to start coming back into the building as of last week, and that's went well. So appreciate everybody following those rules and what that looks like. So one visitor is allowed with patients pretty much across the board from an organizational standpoint, whether that's a medical office visit, whether that's an inpatient. One visitor per day is allowed in the hospital, and we've got signage and we've got directions on our GSH website to help to guide visitors. Before you come, it certainly would be good to review that and know kind of what the visiting hours are, so 10 a.m. to 6 p.m. on the inpatient side, what the surgery process looks like, because that's a little bit different from a check-in for surgery and then being admitted, and then medical office and ancillary like lab and imaging type of visits. The visitor can be with the patient throughout the stay.
And one of the questions people always ask is with regards to testing. So we've been through some transition over the course of the past several weeks. As many of you know, convenient care has turned back into convenient care again, but we are also offering the services kind of like what we did with our respiratory clinic out there previously. So if people have respiratory symptoms that we're concerned of and we want to have testing performed, that testing is still occurring at that site through our facility. And then there's also the Optum site. Now it's out at VU at the Red Skelton facility, correct?
It's at Green.
Oh,
Green Auditorium.
Green.
Yep.
Okay. And so two separate types of facilities. The Optum site is a go register online, go through a symptom checker, and then what we're performing out at the Convenient Care Clinic is respiratory evaluations as we did previously with pull up and call. And then also if your provider wants to have you tested, orders can be placed and then that can be executed out at the Convenient Care Clinic also. So some changes with that over the course of the past several weeks, and then we're getting questions frequently with regards to antibody testing. So many people are wanting to know, should I get antibody testing done? Is there some utility in getting antibody testing done? If I do, when should I do that? And the answer really has a lot more to do with what the future holds in my mind when we get into the fall. So I think all of us personally over the course of the past several months or so have said, well, I'm pretty sure I had it. I had a fever and I had cough and I had congestion. So I probably had it and I think I ought to get antibody tested. But the data really doesn't support that. When we look at the percentage of positives that we have had throughout the state, it is extremely low. And so the likelihood of being found to be positive at this point in time is pretty low also. So I think as we move into the fall, as we start looking for what's going to occur with vaccinations in the fall also, to me that's really going to be the time when it's a little bit more intriguing to say, hey, should I get antibody testing done? Is there some utility in that? Because right now it really hasn't changed much about what we're doing.
Yeah. And that's an important note. So if you do get antibody testing, which there are options available to do that, it is not a pass for masking or for precautions around being around a known individual who may have contracted COVID. If that's the case, there's just not enough information. So that gets to reinfection. So if I have antibodies, can I get COVID-19 again? And that answer still looms out there as a we don't know. But it is available, and as Dr. Stine said, that information in the future we do think is going to be valuable to understand a little bit more about, okay, what do antibodies mean? And also, we have not had anybody antibody tested that was positive that felt like they had it in November or December. So we're not seeing that. Can't say it's not possible, but we have not identified that with anyone.
Yeah. So stay tuned for that. We will continue to talk a bit about antibody testing and where that goes over the course of the next several months, as well as what's happening with vaccinations and the clinical trials that are being performed on that also. Something that has also come up is what's going to happen over the next several weeks and several months. So we're stage 3 now, moving towards stage 4 and then stage 5. We've got some important dates coming up, the 14th, the 4th, and of course everybody is questioning as we approach our next big holiday for the summer, what's going to happen. We got a little bit of a curveball and had a little cookie handed to us right before the Memorial Day holiday, and we don't know that that's necessarily going to happen, that there will be a bit of an early release, but many people are asking, what's going to happen with regards to local activities and things like that. And my suggestion would be is you should plan all of your normal family happenings as you typically would, with appropriate precautions with regards to hand hygiene and separation as best you can. But we're all still kind of staying tuned because a lot of what has to happen for big events, especially as far as large communities, requires tremendous amount of preparation, and there are implications with regards to handling that as a large group and a lot of logistics that have to go in place. And I think a lot of communities have just said, you know what, let's let people kind of warm up to this and let's not plan any big events. So stay tuned to see how things are going to go. Our next stage is going to start on the 14th. Mm-hmm. Can you give us a few numbers on what that means and what we get to do more?
Yeah, so when we move to June 14th, a lot of things that are open with restrictions, those restrictions continue to relax. So in dining moves from 50% to 70%. Your movie theaters increase in capacity. The bar seating opens up within the restaurant/bars. There's other venues that continue to open up. The social gathering numbers that right now is limited to 100 moves to 250. I think a key point that Dr. Stine mentioned with the large gatherings, we've seen a number of large gatherings get rescheduled, and they're not rescheduling for July 5th.
No.
I mean, they're pushing that off into August, September, October. Local community leaders have to make decisions as to the logistics of actually being able to set that up and where that needs to move to. So it's, even though there's dates set for the Back on Track stages, June 14th and then July 4th, that doesn't mean the day after that everything just gets crammed in there, because we still need to be smart about how we're opening things up and where appropriate, still staying in some smaller gathering spaces.
Another big thing that has happened, I think we're all excited about, and our children are excited about too, is sports has opened back up.
Yes.
And so practices are occurring, games are occurring, and we're getting our kids back out and involved in that. Some questions have come up as far as health screenings for them, wellness visits for kids. So we're encouraging people that now is a great time to get in, get your kids taken care of for their annual wellness visits. Also get them taken care of as far as their sports physicals, because as we approach the fall and schools coming up, we need to make sure that that's all well taken care of. Because as we know in primary care, about 2 weeks after school opens up, we get the next big round of all viral stuff that comes around anyway. We usually get a little viral upper respiratory infections, we get some gastroenteritis that goes around, and that's going to confound a lot of what we're worried about now. So now is an ideal time for people to go out and get their wellness visits done, come in, get your school physicals done. One of the things that I found was really encouraging, it had a clever acronym, I don't remember, but the governor came out and, was it in class was what they named it,
Oh, yeah.
but basically said, hey, we are encouraging schools to plan on opening as usual in the fall,
Yeah.
plan on offering the same services that they previously would offer in whatever manners basically they find helpful to maintain that social distancing and reduce the risk of infection. So that's been laid out on the table. I think that's exciting for all of us because I think we want things to go back to normal. Our kids want things to go back to normal. We want sports to go back to normal. And so I think it was nice to see that projected, again, several months in advance so people can start planning for that.
Right. I was very happy to see that it was not an e-learning only.
Yes.
As it opened, very similar to the Back on Track plan, there's a number of guidelines that schools can follow, but the governor was very direct in his statement that schools should reopen. And I think that executive order was as of July 1, as some of the school sports are allowed to start having practices and those types of things, that schools can start looking at how to reopen. Every school in the community is going to have to make decisions as to what their safety protocols look like and how they are doing that. One other piece in June that I did forget to mention with the reopening and some of the state plans is in the month of June, all long-term care facility employees will be tested by the state. So they are rolling that out across the state, and they are also opening visitation in long-term care facilities. As we know, that's a very important piece to the family dynamics of being able to take care of a loved one and being able to visit. Those are outdoor visitations. And there are policies around that the local long-term care facilities will be able to support you with. But that was another move in the right direction of things returning to a sense of normal.
Right. Tiffany, Clint, anything that you guys have as far as questions coming in from the public?
One question is, are there any other viruses going around right now?
Sure.
COVID.
So great question. Are there any other viruses going around right now? And the answer is yes. We certainly have all the typical childhood viruses that are going around right now. There are a number of upper respiratory type viruses that we have seen. Thankfully, not a lot of adult-based things in terms of pneumonia or otherwise. But I will tell you, whether it is based on our current climate or weather conditions, but we have seen a tremendous allergy season this year. Lots of patients coming in with flare-ups of their upper respiratory allergies, problems with asthma flaring up a result of that as well. So in my mind, that has really been heavier this year than what is typical. We have not seen much in terms of the stomach flu going around at this time of year. That's something that we typically will see again towards the end of summer and when school begins, usually about 2 weeks after school starts, we see a bit of an uptick in gastroenteritis and stomach flu type conditions. We have not seen much of that as well. But I certainly have to mention that we've had a bit of a hepatitis outbreak this year in our community and in our county, and that's something that our county health officer is watching very closely. And that, very similar to the COVID situation, is something where we are very closely tracking each of those individuals and contacts and helping to make sure that stays as isolated as we can. That's something that basically has very similar symptoms to gastroenteritis, where you can have diarrhea, nausea, and vomiting, and then of course one of the hallmarks that typically brings people into the doctor is they become jaundiced, and so their eyes get yellow and their skin gets somewhat yellowish orange, and that's usually what brings people to the doctor. Now thankfully the number of cases of that we have is very small, but it's much greater than what we would normally have in previous years, so that's why that's being watched really closely.
Okay, that's it.
All right, well, very good. Adam, any other things that you wanted to discuss?
No, as we continue to reopen, just the plug for everyone to be safe, the hand hygiene, the little things that we forget about when we talk about these big pandemic types of discussions are really where it all starts in mitigating the spread and continuing to focus on that and just be smart as you go on about your lives.
I would mention, especially as it pertains to Adam and myself, to be good about wearing sunscreen, which we would like to point out that we did, but sunscreen failures do happen, I would say. Poison ivy is out there right now. We're seeing tons of that. And then, of course, make sure you wear your bug spray. All right. Thank you all very much for joining us, and we'll be back with you in about a week or so.